Over 25 years ago, ACT UP declared war against HIV and AIDS, working with the Centers for Disease Control and Prevention, sometimes as adversaries, sometimes as allies. We hoped we were on the road to victory. Now, 33 years into the epidemic, 20 years since the expansion of the CDC's AIDS case definition to include marginalized populations, including women, homeless people, drug users, and some children. Of course, we're also more than a decade of holding at 50,000 new HIV infections per year. With all of that, we are not winning. The CDC, and thus this nation, is not in control. When it comes to young gay men and other men who have sex with men of color, not in control. Even with some decrease in rates of infection for African American women, heterosexual women, for some age groups among us, not in control. When it comes to providing comprehensive HIV impact prevention, including accurate and just sexual health education, not in control. And when it comes to advancing the knowledge and capacities of communities and healthcare providers on the issues of treatment as prevention, pre-exposure prophylaxis, post-exposure prophylaxis, not in control. As a matter of fact, for so many, too many Americans, 50,000 a year, uninfected Americans who become positive, the virus is in control. The virus is winning this war. The virus is capturing our sisters and brothers and keeping them hostage for life. Our young black and brown men, our transgender women, our African American heterosexuals are prisoners of war. And while HIV continues to take 50,000 Americans every year as POWs, the leadership, especially at the top, is missing in action. And so we stand here today as an Atlantan, as a woman, as the straight girl with the queer eye, as a person who's been in this fight now for 30 years. We stand in support of reinforcing the Denver principles and re-engaging with the Atlanta principles. We're declaring that the federal government, in direct engagement, involvement, and resources with the community, rise above the occasion. They and we must have and use more, better, faster strategies, actions, and resources to stop the virus from taking our people, to rescue our HIV POWs with the care, treatment, and respect that they deserve. And in honor and with respect to their own name, the Centers for Disease Control must employ the surge, deploy the community as our special forces, and take control of this epidemic. Thank you.